All right, Dr. Stephen Marcaccio from University Orthopedics joining us in studio to talk some injuries. Obviously a big week for the Patriots. First home playoff game for the team since 2019. Injuries, of course, a theme down the stretch for the Patriots. I do want to dive into some of the things that they have been dealing with. Robert Spillane, he told us earlier this week that he is expected to make his return for the Patriots. Obviously dealing with an ankle injury. Kind of how tricky are those ankle injuries? Kind of, just how tricky is it dealing with those?
Right, so what's tricky about ankle injuries is that there's so many different types, right? So you're dealing with high ankle sprains, low ankle sprains, sometimes they're fractures, all those things. A high ankle sprain is something that involves the higher ligaments around the ankle. It's a bigger intensity type of injury. It's longer time out to play. Whereas a low ankle sprain, a lot of players can play through that, maybe a week or two off. But there's a huge difference in the way that those ankle injuries affect the player and how much time's out. And the same with the foot. So with the foot, there are so many different locations and types of injuries within the foot, and the player can miss anywhere from very little time to an entire season, as we saw with a player like Joe Burrow earlier this year with his turf toe injury.
Kind of when you're looking at each player or athlete that you're evaluating, are there little telltale signs that kind of indicate how quickly they could recover, or is it based on just, it could be anything? Well,
it's a combination of the severity of the initial injury, what you're seeing on the field. It's also it takes into account their physical exam. What do they look like? How much swelling is there? How much pain are they in when they're just getting around the locker room from point A to point B? How much can they move that ankle? How much swelling? How limited are they right off the bat? And that's usually what dictates how they progress from there. But all those things come into account. And then sometimes it's just the type of player. Some people tolerate pain differently, and what can they tolerate? What can they play with?
Another injury the Patriots, of course, are dealing with is the offensive line. We got Will Campbell back last week. Jared Wilson still in concussion protocol, but has been practicing this week. Kind of for the viewers out there who aren't aware what the NFL's concussion protocol is, can you kind of outline what that is?
Yeah, so it's a 5-step process. The first step after the concussion is diagnosed. It starts really with just light activity, very low intensity light activity, the recovery phase. That's kind of step 1. And what that has to do is just getting through their activities of daily living, really just calming down and seeing how they recover. Step 2 is once they're feeling a little bit better, they start to increase their exercise activity. It's light aerobic exercise. It's nothing intense. It's just basic cardiovascular exercise. Once they pass that phase, they get into phase 3, which is really more sport-specific exercise. So it's not contact. It's higher intensity for lower durations. It's not the full duration of the practice. Once they pass that, they reach the phase 4, which is a big one, and that's really team-specific activities without contact. So we want to see if they can go full speed, full go without the contact, and if they tolerate that, then they're reach the phase 5. And phase 5 starts with their team physician clearing them from all the battery of tests that they complete. Once they're clear from the team physician, they actually go to an independent neurologist who makes that final call on them, and once they're deemed cleared, they can participate in the next practice or the next game immediately.
And with those steps, is this a situation if they don't pass step 2, do they have to go back to step 1, or is it, you're stuck at step 2 and then you just, until you can get to step 2, you go up to step 3?
Right, it's a criteria-based rehabilitation protocol. So you have to pass step 1 to get to step 2. You have to pass step 2 to get to step 3. If they're hovering at step 2, if they're hovering at step 3, sometimes you need to circle back and figure out maybe why. Are there any other factors that are contributing to why they're not progressing through the protocol as you'd expect? And sometimes it has to deal with the initial injury. Sometimes it has to deal with a history of concussions. If an athlete has had multiple concussions, then their recovery might be a little bit different going through the protocol versus the first time concussion, which may be a little more straightforward. It just depends on the injury and the athlete.
Looking at the other side of the ball, the Chargers, Justin Herbert obviously dealing with an injury of his own, left-hand injury, right-handed quarterback, but just how much of an effect could that have just in anyone, with the throwing motion and just, with his performance on the field?
Right, I mean, certainly impressive that he's been able to play up since that injury and really up until last week. When you watch his tape, the most concerning or the most noticeable thing that I see when I watch him is that it's not so much when he's playing or when he's throwing the football when you notice his hand being affected. It's when he's supporting himself after he's tackled. We saw him kind of wincing in pain after he was getting up from a tackle because he used that hand to support himself. So how much force can that hand take? Now, each week goes by, we're getting further and further out from the injury, so he's getting more and more comfortable. And certainly having a week off this past week going into this game will be helpful for him. So we'll have to see, but it obviously won't be affecting much of his throwing, but the other types of tackling, running with the football, carrying the football, all those things.
And excuse me if this is a silly question, but could the weather and just the cold kind of play into effect of, how that kind of is making him feel?
Sure. I mean, maybe not just him, but all of the players that are injured. The colder weather, you're going to feel a little bit more. It's going to take some time to get loose. You have to get through it. You might be a little more sore to start, and you might have to work your way through it. But for him specifically, if any time there's a fracture or any types of injuries, sometimes that can flare up a little bit in the colder weather.
All right, Dr. Stephen Marcaccio from University Orthopedics. We appreciate the time and insight.
Thank you for having me.